Hey everybody, I'm Cole Cather, and I did my project over Lou Gehrig's disease, known as amyotrophic lateral sclerosis. It's called Lou Gehrig's disease because there was a famous baseball player that played for the New York Yankees back in the 20s that was very good, and he ended up developing the disease, so they decided to name it after him. Okay, so the genetic principles. So 5 to 10% of people who get ALS inherit it from a family member. There are three genes that have been identified that are the main reasons that you can develop ALS, which I have all the evolutionary trees over that we will look at later. And the mutation has been found out to be with have something to do with your amino acid chain. ALS is also what it's called. It's short for amyotrophic lateral sclerosis. Okay, so basically your physical traits that you will have if you have ALS is you will have difficulty walking, which like Stephen Hawkins and Lou Gehrig both had. They were both in a wheelchair. Um, Hand, leg, and foot weakness. This is what Lou Gehrig found out. This is what his symptoms were that kind of pointed him in the direction, and they found out that he had ALS. Slurred speech, which we all know that Stephen Hawkins was not able to speak, which is why he had a computer that he used, that he typed in to speak. And muscle cramps, which I'm not sure with them if they had that, but the muscle cramps is why the their muscles get nerve damage because they're always tense and it messes with them. Okay, and natural history. So if you are a veteran, you it is more common for you to have ALS than a normal citizen. They haven't been able to directly identify why that is, but they have found out that you just are more likely to develop it. But they have found that if you have nerve damage, then it could trigger ALS. And your symptoms of ALS will be shown in the spot that you have nerve damage. So if you have nerve damage in your arm, then you'll start to show weakness in your arm and muscle cramps and all the symptoms in that spot that you were injured before you will in any other spots, but those will also come to follow. Okay, and management. You can go to physical therapy to try and help you maintain your strength and push off the ALS to a later time in your life. There's medication that'll help with pain and also trying to help push it back. There's feeding tubes because people with ALS, everything in their body is weaker, so their throat isn't as strong, so they're not able to swallow their food as well or water. So it's better if they just get a feeding tube put in so then they can have the food just fed to them. So then they don't have to worry about them choking and all that. And they need regular visits to ear, nose, and throat doctors since they're not going to have their throat that gets water down it when they need it, or like anything with their ears. They can't clean their ears or anything like that, so they have somebody that has to come do that for them. And their regular visits to their doctors are just to make sure that they're keeping a good hygiene and not falling behind and having more problems. Okay, so this is one of the genes that um, can trigger ALS, and you can see that gorillas, chimps are the top two related to humans when it comes to this gene, and it's the same with the SOD1 gene. The chimp and the ape are both up there, but this last one's a little different. The other two have sheep has a sheep on there that is 86%, but on this one you have a horse that replaces it with 88%. So this C9ORF72 it accounts for 30 to 40% of the ALS patients, and the SOD1 accounts for 20% of the ALS patients, and they have only been able to identify, out of all 100% of cases, they've only been able to identify 10% what they come from. But in those 10%, they have narrowed down 80% of what the genes could be. And this is just the chart that I had back earlier, the gorilla and chimp at the top, and then everything else. Okay, that's it. There's all my citations that I used, and that's ALS.